So this we are doing the how to upturn the corner of the mouth, because the corner of the mouth is the one area which is most when we talk about lips, this is the first area to be affected when it comes to aging.
Right.
So what happens, how it gradually grows is, first of all, initially it is upturned, then later on gradually it becomes horizontal, and then it starts down.
Mm. Right.
Right. So many individuals who are not wanting to have lip fillers, they might just be concerned about the corner of the mouth only.
Mm-hmm.
So many
Mm.
factors which lead to the drooping of the oral commission, and this condition is also called as resting bitch face. So there is a whole paper done on this. You can go through. I mean, net pay you will easily get this resting bitch face. It is
Resting.
resting bitch face.
Yes. Okay.
So so what are the factors? A multitude of factors: bone, fat, muscle, skin. All the layers are affecting, and we have to assess before injecting. We have to assess the contribution of each component. So first of all, we are losing bone along the cheek zygoma, the maxilla, and the back of the mandible. And this causes, lack of the anchoring support to the overlying tissues, which are causing downward and forward migration of tissues. And this forward and downward migration of the tissue is causing an extra weight on the corner of the mouth. So along with this is the extra weight over there. Then secondly, there is deflation of the lips. The volume is reducing. And we are not very, we are not aware of the, loss of volume in the lips. We think it is dehydration. It is usually mistaken as dehydration.
It
And
is because of the orbicularis oris muscle.
yes, the orbicularis oris muscle is a pursing. It purses the mouth. So
Mm.
the volume is
Due to
reduced.
which
Hmm.
thinning of lips
Yeah.
is happening.
Yeah. Thinning is happening. Volume loss is there. And as the chin recedes, the soft tissues deflate, and there is less of support from beneath also.
Right.
This is the entire
Right.
dynamics of the lower face. Now, all these changes also impact the activity of the overlying muscles. I told we will do a session on myomodulation also, like, how the muscle activity is altered by the changes in the tissues underlying them and overlying them. Right. So the
So
dynamic,
biomodulation fillers, no
uh,
Botox.
no, it is with
I
fillers.
feel okay. So you teach Botox as well?
Yeah, yeah.
Acha, I'll be taking a class on Nefertiti.
Oh, definitely. Very good
Yeah,
result.
I'll be taking a. I'll take one class.
Yeah.
Okay. Yeah. Hmm.
So we have
Okay.
the elevators and we have the depressors. The dynamics is changing. We'll be discussing this. So it is important to understand what are the factors causing the downturning of the angles. We have the factors responsible for this downturning or commission: skeletal, soft tissue, muscular, and skin. We have to categorize. Skeletal factors: facial bones are framework for the attachment for the overlying tissue, providing stability, structure, definition. Support from this platform diminishes as the bone recede and remodel with age, resulting in recession and repositioning. This results in inferior medial repositioning of fat pads and muscles, and they realign over the shifting bony foundation. So these changes are generally in small millimeters. And despite the small magnitude of bony changes occurring at the deepest level of facial anatomy, the effects are even often dramatic. The changes in the bone are very minimal, like just a few millimeters, but the impact of these changes is quite large. So the overlying structures amplify the effects of these minimal changes. So skeletal factors can be contributed at factors at the level of the mouth, that is mandibular recession, loss of, no, this is wrong slide. Don't go by this. Now, the aging skull, depending upon the decade in which an individual is, the contribution of skeletal changes varies. So if you have an individual between 30 to 40 years of age, the skeletal changes will be minimal. If there is someone between 50 and above, the skeletal changes we are expecting to be more in them. So we have to have in the back of our mind, we need to, keep analyzing the contribution of each layer. So if you're injecting a 50-year-old, so the contribution of skeletal factors is going to be more, obviously. So the degree of skeletal changes may vary from individual to individual. Then there are soft tissue factors.
कोई दरवाजा बंद करो उधर, पापा पास जाओ पीछे, सॉरी एक
So
मिनट,
no, it's
आप
okay.
पीछे दरवाजा, गो देयर, अब,
So the
ओके
jowl fat makes up the superficial fat layer and the lower third of the face. This is the jowl fat, right? Together with the mantle and submantle fat. So the jowl fat is medial to lateral temporal cheek fat. This is a lateral temporal cheek fat. This is medial to it. It is lateral to the nasolabial fat, right? And medial to the middle cheek fat pad and superior to the mandibular. So the loss in this tissue, it doesn't descend, but it it deflates.
ओके
So the underlying support to the muscle is gone. So there is deflation of the jowl fat pad. Then there are soft tissue changes above the commissure. Right. So this I'm going a little fast because I'm explaining this again later on, you know. So now there are soft tissue changes which are happening at the level of oral commissure. So we can divide changes happening above the oral commissure, changes happening at the level of the oral commissure, and changes happening below the level of the oral commissure. Right. So we have seen the changes happening above the level of the oral commissure. Changes at the level of the oral commissure, that is deflation of the jowl fat pad, soft tissue changes above the commissure, inferior movement of nasolabial fat, infralateral movement of cheek fat pads. Muscular factors, the muscles lose tone and elasticity, reducing their leveraging effect to the overlying skin, and the elevators become less active and the depressor becomes more active with time. Why are the elevators becoming less active? Because
of loosening of ligaments.
yes, loosening of the ligaments also, and the underlying support to the muscle from the fat pads is receding. The bone is
Okay.
receding. So the the fulcrum over which the muscles move is blunting down. So which in turn leads to their underactivity.
Okay, ठीक है, got it.
Now we all have a muscle which travels from the corner of the mouth down towards the jawline, and this is called DAO. And when this muscle contracts, it pulls the corner of the mouth down. And in some people, the action of this muscle can be excessive, and relaxing it with some injections of filler can weaken it and cause the corner of the mouth to come back up. Now, skin and muscle interaction, which is the dynamic discord. Yeah, you wanted to ask something?
No, my daughter is disturbing me. She has always a problem whenever I'm into a class.
No worries, I can understand. So both these age-related features are caused by hyperactivity of the depressor, DAO and platysma. It is not only DAO, it is platysma also sometimes.
Right.
So again, now this I said I'll be doing again. Various physiological factors can be classified into above the level of the mouth corner, at the level of mouth corner, below the level of mouth corner. Fine? Above the level, there is remodeling of zygomatic arch, maxillary recession. There is lack of support to mass holding the muscles and soft tissue. As the anchoring support is lost, tissues fall forward and downward, extra weight on the corner of the mouth. At the level of the mouth, volume loss in the lips at the corners, and downturn is often preceded by a horizontal phase. So what happens? The downturn doesn't happen immediately. First, it will become horizontal. For me, it is little horizontal. Lateral 0.5 millimeter is horizontal first. And then gradually the downturn starts. Yeah.
Mine are downturned. I really don't like them.
Yeah. We inject some filler.
हाँ, मेरा ना एक्चुअली मुझे लिप फिलर लेने का मन करता है, बट आई एम स्केयर्ड ऑफ द पेन फर्स्ट ऑफ ऑल, एंड सेकेंडली दीज डाउन टर्न ना, बिकॉज मेरा डीएओ में मैंने एक बार बोटॉक्स लिया हुआ है, तो अभी वो इफेक्ट नहीं रहा उसका, बट डीएओ का बोटॉक्स इतना कम चलता है ना, हार्डली 2 months, बिकॉज दिस इज द मोस्ट मूविंग पार्ट.
But you
तो
know what?
मुझे
Only 2 units are required, no? So you can do it every 2-3 months if somebody has just
हाँ,
the DAO
लेकिन
component.
आफ्टर बोटॉक्स बहुत अच्छा लगता है, मतलब वो थोड़ा सा, बट मुझे लगता है कि फिलर इज अ बेटर चॉइस,
Yeah,
इफ
long
यू
term.
जस्ट upturn the corners,
Yeah.
बिकॉज डीओ को
And
तो बहुत ज्यादा कंट्रोल
in
नहीं
some
कर सकते
cases,
हैं.
you know, when you do the cheek, automatically the lip
भी
corner
हो
rises. When do CK2,
हाँ,
automatically it rises. NL1 also it helps to control. So
Yeah,
that is
it
why
helps.
always, approach the lower lip in elderly after you've addressed the mid face. For a young patient,
Okay.
it will be fine. But if
Mm-hmm.
you expect, now some people anatomically, they have high cheekbones. So
Yeah.
in them, you can
Yeah.
directly address here.
Okay.
So that
Okay.
individual anatomy also matters. I've seen some people who have very good cheekbones, they have narrow cheekbones and high cheekbones by birth,
Mm.
by genetically. So in them, you can omit the cheek points and all that.
Okay.
So at the level of the mouth corner, there is deflation in the lips, right? Then below the mouth corner, I said mandibular recession and the
Mm.
pre-jowl fat pad. So two things. One is the bone
Mm.
and one is the soft tissues. And then muscle is
Mm.
excessive pull by the DAO. So below the corner, we are having the mandibular factor, we are having the pre-jowl fat pad factor, and we have the muscular factor. Three factors.
Right.
Now, all the before mentioned factors need to be evaluated in totality. So you can make a chart above the above factors, below factors, down. Whenever you're planning a procedure, whatever I've mentioned here, just make a chart of it. And when you analyze, just put a tick, whatever is contributing in that particular case. Right?
Right. Right. ठीक है.
I was wanting to make a chart, but I didn't get time to do that.
हाँ. Okay. कोई नहीं, वो कुछ आपको factors एक बार idea लग गया तो I can easily
हाँ.
make then.
So then we
Okay.
have this classification of mouth corners in Asian women's a paper. You can go through it. Here, naturally, this is not due to aging. This is naturally what individuals have, type of lips.
Mm.
So if you're interested, if you have time, you can go through this paper also.
Right.
This is a link to that paper.
Okay.
So now we are coming to the injection techniques. First is
Mm.
there are two techniques. One is the subtle mouth corner lift with a sharp needle. In this, what is the principles of injecting? That mouth corners are lifted by injecting the contours of the lower lateral lip only. Now, in this case, we are assuming that the factors above have been dealt with. Right. Now
Mm.
we are addressing the downturning. So mouth corners, we are lifting the by working on the lower lip only. So the contribution of uplift is first by the lower lip and secondly by the upper lip. Right. So this results in a more cheerful looking face. So the defining factors, again, the type of material used and the volume of filler used. Rationale is that we are providing minimal support which stabilizes the mouth corner through the lower lip. Ideal patient is a young patient with intact lip with minimal drooping of the corners of the mouth. This is injection scene. We have the linear threading. Entry point, I'm going, next slide is a diagram. Entry point is the corner of the mouth. Direction of insertion is from the entry point, move downwards into the lateral 0.5 to 1 centimeter of the lower lip, like this. So this is your entry point over here. You open it like this, right?
Okay.
And
Okay.
then make an entry point at the corner and then go down in the lower lip. Lateral 0.5 to 1 centimeter of the lower lip. Inject with a linear threading 0.5 to 0.1 ml.
Okay.
This is the first. This is for minimal, very little downturning of the angle of the mouth.
Mm.
So volume per linear thread is 0.05 to 0.1, 27 to 29 gauge needle. So pull the upper lip upwards so as to properly expose the corner of the mouth. So when you pull the upper lip upwards, you can divide the corner of the mouth into the upper half and the lower half. Right. So from the
Right.
lower half, make your entry from the lower half and go into the lower lip.
Okay.
Fine.
ठीक है.
Insert the needle
Mm.
precisely into the lower half of the mouth corner, advancing the needle into the lateral 0.5 to 1 centimeter of the lower lip. Deliver the product by retrograde injection towards the mouth corner.
Mm.
So
ठीक
you
है.
can do it from above also, and you can do it from beneath also, like this. You can make the entry point downward.
तो उससे आपने जो लास्ट क्लास हुई थी तो उसमें बोला था कि अगर हम ज्यादा लैटरली करेंगे तो द माउथ ओपनिंग विल बी वाइडर देन.
That is in the body, or that is in the mammalian body. This is, we are talking about border,
अच्छा, बॉर्डर. ओके, ओनली द बॉर्डर.
only the border. If
ओके.
I'm wanting to expand the arch of the lower lip, then I will inject here in the body of the lower lip over here,
ओके.
lateral to the tubercle.
ओके.
If I
ओके.
want to narrow
राइट.
it down, then I will inject into the tubercles.
Okay, right.
Now here we
ठीक
are
है.
doing only the border, vermilion border,
Hmm.
not the body.
Right.
This, only the border. Fine. Now, if in this case I want to increase the arch of the lower lip, then I will inject over here. This is the tubercle. Lateral to the tubercle, if I inject, then the arch becomes broad.
Right, right.
Right. But here we have to uplift this corner. So for this, we are providing support over here, and we will fill a little triangle over here.
Right.
Like this. Then second is the classic mouth corner. First, initial was the subtle mouth corner lift, in
Hmm.
which we inject only the lower lip. Now, classic mouth corner lift, again, only the lower lip injected with a sharp needle. Mouth corners are lifted by injecting the contours of the lower lip, and this results in a more cheerful facial expression. Again, the same thing is repeated, sagging of the mouth corners. So this is from beneath.
Okay.
The entry point is here. You cross the corner of the mouth and slightly above,
Okay.
right? So this is how you inject. Now you start injecting, put a bolus here and inject retrograde linear.
Okay. We should put a bolus above the upper
Yeah.
border of the upper lip.
Yes, yes. This is exactly the line. It should be crossing this area. It should cross the area. The needle should be crossing this area.
Mhm. And how much the amount?
0.5, 0.5 to 0.1.
Okay. Okay, right. So then we have to mold it also ना, because अगर हम
Yes, yes.
इधर
When you mold it, you do the molding in the end, because again, when you put your gloves into the oral mucosa, then a lot of contamination. And for molding, you ask them to open their mouth slightly and then mold it from.
Okay, okay, right, right, right. ठीक है,
Right?
ठीक है. Hmm.
Now injection
Okay.
techniques for slightly downturn. So this is, step one, draw an imaginary line starting from 0.5 centimeter. This I have explained actually. Lower, you can go through this. I'll provide the recordings, and laterally to the risorius muscles. So this, this is injecting into the risorius. It is going up till the risorius.
Yeah, Resorius travels from
Yes.
corner of the mouth to the
Mouth.
masseter.
Yes, yes, yes.
The medial border of masseter.
Yes.
Okay.
Fine.
Okay.
So that's how. Do not inject the upper lip in this case, as the lifting effect will be lost if you inject the upper lip.
So we have to give a bolus. We'll go here, cross करके corner of the mouth पे ऊपर जाके around 0.5 centimeter ऊपर.
आप तो medial जा रहे हो. We have to go lateral.
अच्छा, like this. Okay.
Yes. Yes.
So
Yeah.
0.5 centimeter above,
Yeah. Yeah.
and we have to inject 0.5 bolus there
No.
and start coming out
Total is
in a retrograde.
0.5 to 1. Little bit bolus
अच्छा,
and then retrograde linear.
then retrograde. ठीक है, और फिर उसको मोल्ड कर देना वहीं पे in upper direction.
Yes.
Okay, got it, got it. अपर लिप में इंजेक्ट नहीं करना है.
इस जब previous
तो हम
technique
सारा
है,
ही
नहीं.
हम सारा ही लोअर लिप से ही बाहर जाके लैटरल
Lower lip
रहेंगे.
से,
ओके.
we will enter the lower lip, then cross the angle, and then go up to the result. Upper lip,
ठीक
we
है,
are not
got it.
touching in this. Now, then there is another technique which is modified. In this, the upper lip is also injected. So this is for moderate downturn. The earlier one was mild downturn. This is for moderate downturn. More material is placed in lower lip to risorius, and upper lip is included close to the mouth corner. So precaution should be taken while injecting upper lip such that no counter pressure is built from above. So this can be made sure by avoiding injecting the first 1 to 3 mm of upper lip margin. So we do not have to inject here. If we inject here, then it will create a counter pressure. To avoid this area and then just inject this border. So what is happening? You stabilize the tissues. When you inject here and when you inject here, these two will, it will make as if the lip is coming closer. Right? These 2 points will move toward each other. Right? And gently push up the mouth corner. So in this, we are, giving a support from the lower lip also, and we are adding this support is getting an additive effect from injecting over here,
Right.
right? So this is how we can do this. So these are the cases where we are just working on the corner of the mouth without the lip filler.
Okay. So in this जो भी आपने पहले एक टेक्निक समझाया है वही वाला जाएगा जो माइल्ड का रहेगा.
Mild
उसके
का,
अलावा वी हैव.
yes, these 2 points are extra.
अच्छा, दिस इज द सेम जो हमने लास्ट किया था.
These are the same. It could be like this
ओके.
or like this. Now we
ओके,
will
वन
have
ओनली वन
downturn corner. Yeah. So now there will be 2 scenarios: downturn with the lip filler, downturn with the marionette line. So then you need to adjust accordingly.
ओके.
So if we are doing marionette also here, then this is the triangle that we fill to give even more
या.
support. Fine.
So
And
how
then
to
we
fill
can do
this triangle? Where we should inject then if you
middle,
want to fill this triangle?
middle. We see this is the marionette line. This will be the marionette line. So you make the
Right,
entry
right.
point over here, and the entire length of the needle, you give support over here. So first you do marionette line, then you do corner of the mouth.
Okay, right. ठीक है.
If you're doing both marionette and corner, first marionette, then corner.
Okay.
So if downturn mouth corners are associated with marionette line, then these need to be addressed along with. So now these are the different types of downturn corners you'll have. Either you'll have horizontal, slight downturn. There'll be downturn with shadowing under the lateral lip. That means there'll be a downturn, little shadow over here and no marionette line, just a shadow. Then there'll be downturn plus a marionette line which extend only halfway till here. And then there'll be a case where this is downturn is there and there is full-fledged marionette line.
Right.
The pre-jowl and all that. Okay? Marionette halfway, full length marionette.
Okay.
So make sure to treat cheeks and nasolabial before treating the mouth corners.
Always.
Always, because there will be slight in aged, like in senior age group, there will be slight contribution from above also.
Yeah, because see, in senior age group patients, definitely this the upper, above the border, I would say that above the line, there's more aging.
Yeah.
पेशेंट को सबसे पहले वहीं पे ही रिजल्ट देखना है. ही विल नेवर वांट कि यहाँ पे सैग है, लिप अप टर्न कर दो मेरे. सो वो डेफिनेटली हमें पहले लेना पड़ेगा. व्हाट आई फील इज दैट अप टर्निंग द कॉर्नर्स ऑफ लिप will be highly appreciated in young patients.
हाँ.
और
इतना
mid age
डाउनटर्न होता नहीं है. But the thing is उनमें डाउनटर्न ज्यादा होता नहीं है.
35 to 45 ईयर जो एज ग्रुप रहता है ना,
That is the best.
उसमें आना शुरू हो जाता है. हाँ, उसमें आना शुरू हो जाता है. Okay, got it.
Fine. So this is it for the downturn this thing.
Corner of the mouth.
Corner of the
Okay,
mouth.
we have time left now. We can discuss.
4 minutes. We have 4 minutes.
4 minutes we are left. Okay. So, okay, fine. एक Nefertiti lift we are going to learn. Nike cheek.
ठीक है.
You said. And then we are coming to the lower face.
अच्छा, lower face. Fine.
Lower face में जो भी आपका ये jaw, marionette, ये सारा एरिया lower face का हो जाएगा. And CK 4 and 5 में मुझे क्लास चाहिए.
ठीक है. तो नाइकी जो है ना, नाइकी चीक्स, उसमें we will do CK4 CK5 together.
ठीक है. That's good. Yeah, that is good. Okay. अच्छा, नाइकी चीक्स में nasal डीप नहीं होते पेशेंट्स के? अच्छा, वो डीप नहीं होंगे. ओके, राइट. ओके. I will share the picture of this girl only जिसका मैंने किया अभी आपको. इसका इनिशियल लिप्स आई एम गोइंग टू शेयर विद यू. वो वही वाली बात है ना, पेशेंट अपनी एसिमेट्री भूल जाता है. एक्चुअली उसका लोअर बिल्कुल ही एसिमेट्रिकल था, यहाँ आके एंड होके एकदम ऊपर जा रहा था. तो इधर था ही नहीं लैटरल और इधर प्रॉपर था. सो लास्ट टाइम फिलर दिया, आई बिल्ड इट. आई विल शो यू बिफोर आफ्टर ऑफ द लास्ट टाइम. दिस टाइम अगेन शी हैज टेकन 1 ml ऑफ रेस्टलिन किस. तो अभी भी उसको लग रहा है. देन yesterday only again I 0.4 was left and I did 0.4. तो वो वही चीज मैंने आपको जो दिखाई थी, कहती है मुझे लिपस्टिक को आउटलाइन देना पड़ता है एक्स्ट्रा। आपने बोला था रेड कलर की लिपस्टिक है, अगर आउटलाइन एक्स्ट्रा देना पड़ रहा है तो यू अंडरस्टैंड दैट शी नीड्स अ पाउटी
वर्जन
लिप।
और चाहिए,
सो
पाउच चाहिए।
हाँ, yesterday I have given her 0.1 year and 0.1 year,
हाँ।
इन दोनों में 0.11 दिया।
हम्म,
लोअर लिप में मेजरली यहीं पे ही वर्क किया, कॉर्नर छोड़ के, कॉर्नर से पहले वर्क किया इधर।
हाँ।
बट अगेन जो अभी करंट पिक्चर है उसमें अभी भी उसका लिप थोड़ा सा यहाँ से
Efficient है।
डेविएटेड लगता है, बिकॉज ये पूरा नहीं है, ये पूरा है,
हाँ।
लाइक दिस। तो
एनाटमिकल जो
वो
फॉर्मेशन है वी कैन नॉट चेंज।
हाँ हाँ। ओके, आई विल एक्सप्लेन हर, थोड़ा सा और देंगे तो, अभी बहुत बेटर हुआ है पहले से,
हाँ।
थोड़ा और देंगे तो देन मे बी शी विल बी सेटिस्फाइड।
शेयर
व्हाट
द
एल्स?
पिक्चर्स।
आई विल शेयर। व्हाट एल्स? अभी रिसेंटली तो और कोई केस नहीं है मेरे पास, फिलर का वही सब चल रहे हैं। ठीक है।
ठीक है।
आप भी मुझे टॉपिक सजेस्ट कर देना जो मुझे लगता है कि मुझे विल हेल्प मी, कुछ एडवांस एडवांस पे, इफ आई कैन मूव ऑन टू सम एडवांस टेक्निक्स और समथिंग
एडवांस
लाइक
में तो
दैट।
इतनी सारी हैं, लाइक इट्स लाइक यू नो यू विल गेट लॉस्ट।
बट वांट टू लर्न।
ठीक है,
आप
let's
मुझे
do these
टॉपिक्स
basics, 4 5 things that you have said now. Let's do this in 1 month, next month, and then gradually
ओके,
I'll give you a list of
या
topics and then you can choose.
श्योर श्योर
है ना?
श्योर श्योर। you would have attended this AMWC before?
Yeah.
Okay, they're helpful in learning na?
Not learning, I would say networking.
अच्छा, तो वहाँ पे टेक्निक्स एंड ऑल, आर दीज आल्सो डिस्कस्ड, न्यू टेक्निक्स एंड
They are
समथिंग
boring,
लाइक दैट?
मतलब sessions तो मुझे boring लगते हैं उनके, but networking
अच्छा,
is good, you know, meet new people, new doctors, new places, something like that.
ओके, राइट, सो यू आर गोइंग टू मोनाको दिस
No,
दिस
not
टाइम?
this year, not this year.
या नॉट दिस ईयर? ओके, राइट, ठीक है। सो आई वाज लाइक कि शायद वहाँ पे भी कुछ नई एडवांस टेक्निक, पर मुझे, लेट्स सी, इट इज गोइंग टू बी माय फर्स्ट एक्सपीरियंस।
Yeah. You
लेट्स सी।
have your own experience.
या एग्जैक्टली।
Fine. So it is.
आपने ना मुझे, आपने अपने उसमें डाला था, वीडियो में किस में डाला था, पेशेंट का कुछ आपने, काउंसलिंग, नहीं, पिक्चर्स का कुछ आपने डाला था, वो भी कराते हो? मुझे, मेरे पास ना सॉफ्टवेयर नहीं है जिसमें मैं पेशेंट का मीन्स, आई मीन